Hi, Elmarie again. In this video I'm just going to show you a couple of tips that ensure our safety and our comfort. I can't say during surgery, but immediately after surgery and for the weeks after that. We have to be very careful that we keep this angle between our upper body and our leg that was operated on at not less than 90 degrees. I know I repeat that in many videos, but that is crucial until the muscles are tight enough again and the flesh is tight enough again around the implant. So we need to sit high, but I'll show you in the rest of the video some tips to make things easier and safer for us. It is very important that we don't trip at all, especially in the first couple of weeks. We therefore need to ensure beforehand that any loose objects, any loose mats are removed. What I've done, this is folded now, this is my bathroom mat. It's a sort of full floor mat, but it's loose so I can wash it. I've folded it and I've placed it under my bed before I went in for surgery, so that I could not ever trip over it. It's safely under the bed. We're told that we need to sit high initially to ensure that the implant does not slip back. Therefore we should never bend low, we should sit high. And then I'll show you something that my surgeon said to me. Well, my physiotherapist kept saying, just ensure that your operated on knee or leg never crosses the center of your body. My surgeon had his own expression of explaining that. Now, what I did beforehand is, I'm fortunate on my couch, there are loose cushions. So what I did is I removed the bottom of the one end and I made this a double height, and that one is the normal height. So this is where I sat and read and crochet and all sorts of things at a high level. I'm going to show you now, and then I'll also share the little secret of what my surgeon said to me. My surgeon is an absolute expert. He's incredibly professional, he's quite strict, and he's very serious, which is understandable, you know, because this is life-changing, but it can be life-threatening, surgery like this, if things don't go well. So I've mentioned it in other videos as well. He's an absolute perfectionist and he does things right, and of course I so appreciate that. My physiotherapist has warned me several times, and I've read many things around my right hip was operated on this time, that we should for the first couple of weeks ensure that this operated on leg never goes across the center of your body. So, you know, sit with your legs straight. I have some videos where I show some tips when you lie in bed. We always need to ensure that our knees are separated and that this one will never cross over. You know, especially us ladies often tend to sit with our legs crossed. My surgeon definitely sometimes has a little twinkle in his eye, and then he says to me, Elmarie, remember, sit ugly. And then he sits like this. Now, of course, this ensures that your leg will never cross the center. So please keep in mind, sit ugly. Just ensure that you wear the right clothes when you sit ugly. Good. Let's ensure that that implant does not slip. There we have it, a couple of very easy tips. It makes total sense, you know, but we don't normally think of it unless some medical expert, like a physiotherapist or surgeon, actually makes us aware of it. So let's be safe and secure until we're fully healed. We'll talk again. Bye-bye.